Hello friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I never really claim to have an original thought. I just take complex thoughts and simplify them for you. However, what I'm going to explain today, I believe, is an original thought, observation, and treatment for a disc issue, meaning the squishy part, for lack of a better word or explanation, the squishy part that's between two hard vertebrae. And this phenomenon can affect either your lower back or your neck, and to a lesser extent by far, the middle back. And this is an inflamed disc. And I'm going to tell you right now, no medical doctor will recognize this. It even exists. It's not in their algorithms. 99.9% of chiropractors probably don't even recognize this either. And I noticed it over the years, but since 2020, instead of seeing this phenomenon twice a year, I see it probably twice a week. I'm going to show you x-rays and show you what I'm talking about. These are x-rays. A young man, a young dad with a baby imminently on the way. And this is the lower back vertebrae here. This is L5, L4, L3, L2, and L1. This big bone here is called the sacrum. That's the foundation bone of the spine. And what I've gotten to the habit of doing is measuring these spaces between the vertebrae. A normal space for a completely normal spine, which I'm going to tell you, very few people have a completely normal spine. They do exist. They probably exist more so outside of my office, but I do see very normal spines, but it is a rarity. So in a normal spine, this space should be 12 millimeters. And see, this one is 11.92. So that's very close to normal. Anything above that, I call an inflamed disc. And you see this right here, 17.63 millimeters. That's a huge difference over 12. And then this one, the 14.5 millimeters, that also is a huge difference over 12. And anything over 12, I consider an inflamed disc. And this would be the L5 disc and the L4. And what's interesting about these inflamed discs is that they cause the same exact pain as if you had a herniated disc. Herniation means that this disc material, which on the very outside, the covering is like burlap. It's like a crisscross of fibers, and on the inside is jelly-like. And in a herniated disc, the crisscross fibers tear or break either partially or fully, and then the jelly part kind of bulges out, kind of like a water balloon if you were to squish it between your hands. In an inflamed disc, that doesn't happen, but the space between the two bones greatly expands. And I explain to my patients, this is like having a bruise inside your spine. The pain is horrible. And what starts to happen, and honestly, no medical doctor is going to tell you this, even the spinal surgeons and the spinal specialists, and a lot of chiropractors don't recognize this either, is that the muscle that's right there at those lower back vertebrae called the quadratus lumborum, it gets tightened. It almost feels like two fists, one on the left and one on the right side of your spine. And that greatly disrupts your ability to move. You can't bend forward, you can't bend back. If you try to go to one side or the other, it's gonna feel just very, very stiff, and you can't even bend over to tie your shoes, let alone do anything else in life. So this inflamed disc gets compounded by this severe muscle spasm. And what I do at my office is we address both things at once. First, we've got to get rid of that inflammation, and we do that with one or two or both of these things, with a supplement that's based on turmeric called therakermin, and also with our Wellness Pro frequency medicine that reduces the inflammation. And this is the quickest way to get that inflammation out of the disc. The second way we attack it at the same time is to release that muscle spasm, and we do that one of a few ways. One is with either therapeutic massage, myofascial release, or again with the frequency medicine to get rid of that muscle spasm. And I have seen so many patients over the years who have been to multiple spinal specialists, physical therapists, chiropractors, massage therapists. Nobody can even pinpoint where their problem is coming from, and certainly they don't address it until they come to our office. And this is why I say we help the unhelpable, because I see things that other professionals don't. And where people have had pains for weeks, months, even years because of this inflammation of the disc, we are able to help them to feel extreme improvement within a week to 2 weeks. And it does not come back. And that's the great thing about an inflamed disc, is that the inflammation goes away and it will heal at 100%, unlike a herniated disc, which always has a weakness. The other thing that I want to make a point of is that the disc inflammation can affect the nerve root, but doesn't always. And by that I mean disc inflammation causes severe pain, but you won't see the muscle weakness of the legs. You won't see the loss of sensation or numbness in the legs like you would with a herniated disc and a nerve root compression. And that might be another video for another day. So if you have questions about that, if you need some guidance, please leave a comment below. And absolutely check out our website for more information on that. And you know what? Why don't you educate your chiropractor while you're at it? Have them watch this video. Be well. Bye for now.